Innovation is a necessity because we're in a place now, I can say, where despite what we know works in public health science and best practice, we still have significant health inequities here in the US and globally. And so to me, the purpose of innovation in the public health context is to really say, how do we ensure that the broadest number of people or the broadest scope of population can benefit from what we know works in public health science? And unfortunately, we're not there today. And so innovative approaches are needed to try to get us there. We have no shortage of innovations that can improve public health and well-being for millions and millions and millions of people. But I think the big opportunity is to really think about how to tailor those solutions equitably to everybody. And what we find is something we call the digital divide, in which we have large swaths of our population who are digitally connected, but not really getting deep access to the digital health solutions that we know work. And I think that that's the big opportunity, whether we're talking about in the US or in a global context around digital health, is more equitable innovation. In my entrepreneurial experience, I founded two different companies, one called Access.mobile, which worked on digital transformation of healthcare service delivery in African countries, and InOn Health, which used the power of mobile phones and texting to better connect people to care. And what we found is that no matter whether we were in Kenya or in the US, text messaging on mobile phones was a great way to connect low-income populations to care. However, for a lot of people, it wasn't seen as the most sexy innovation, right? And so I think in public health, there are lots of ways we can support more inclusive design and more equitable innovation. And it's not always about what we say are the sexy gadgets, but there's existing technology which can be used in really novel ways to connect people to care. As a senior fellow and lecturer at the Yale School of Public Health, I'm working within the Department of Health Policy and Management to really support the dean's pillar around innovation and entrepreneurship. And I think when you think about innovation and entrepreneurship, that's a lot of what we think about, is how do we take things that work through what we know is best practice in public health and really scale them to increase well-being and improve well-being for a lot of people. And so I feel like at the core of public health and the mission of the school is that ethos of really supporting communities at population scale. And that's what really drew me to the school as well.